All right. So this is a question I get all the time. I see this come up with almost every single doctor, chiropractor that we've worked with in the Focus Academy, if they've been in practice a couple years or more. And really we get it from younger doctors too, but this is really common in doctors who've been in the field. They've been in family practice. They've been taking care of a lot of kids. They've done a lot of the things out there to attract a lot of kids into their practice and the things that kids struggle with, like behavior learning and socialization challenges. They're doing a really great, what we call the first question, input, processing output, and indicators of altered input processing out. Really pretty good in practice at looking at the first question, which of course we know is subluxation, neurostructural shifting, going, hey, we know that if we have altered neurological function or adaptability, and we know that if we have indicators that subluxation is present, of course there's a structural and neurological component to that. If that's there, it's going to alter the way a person of any age engages with themselves, outside of themselves, connects, learns in their environment from themselves, their movement patterns, impacting the way they move their bodies. You're going to see that show up somewhere. And so, yeah, that's what we call the first question. The thing is that so often doctors who've been in this long enough, or who really want to understand what's going on and really answer the tough questions that, one, they're asking themselves because they're curious, they're intellectually curious, they want to connect the dots. They want to understand why some kids do really well with just asking and answering and correcting that first question. State of the nervous system, communication within the nervous system. But then some kids don't. Or why do some kids, indicators of subluxation, structural and or neurological, look worse and the kid's doing better, maybe symptomatically? Or super commonly, maybe the initial concern or challenge that the parent was bringing the child to you for, like emotional regulation or, socialization or regulating emotions in the classroom or with family members or, big outbursts at home or at school. Maybe those things are better, but now there's social anxiety, or now there's avoidance behavior, or now there's control-seeking behavior, and really going, why? Why is that? And how do I explain that to a parent if I don't understand why that is? See, this is why I say the doctors that come to us in the Focus Academy and become Brain Blossom doctors are the doctors that have been in it for a little bit, or they're really intellectually curious and they're like, I know there's more to this story. I know that first question, the nervous system, the adaptability, the communication, it has to be the foundation. But what is the impact on the developing brain and the trajectory of the developing brain that an altered nervous system, altered neurological function, altered input, processing, output, what is the impact that has on the developing brain, on the developmental trajectory? What does that look like? How does that show up in an exam? How does that show up in observable behavior? How does that show up in what we call expected stops along the way, or predictable stops along the way of healing? How do we understand that if we're only looking at the first question and we're basically treating the behavior, the challenge, the symptom, albeit not a musculoskeletal one, usually one of the mind and cognition and regulation? If we're saying, hey, we have to treat, without maybe saying treat the nervous system to get rid of this symptom, we're really becoming very mechanistic and we're not understanding more about what was the impact of the altered neurological function on the developing brain. How do we actually understand that in practice? How do we have an exam that picks up the clinical clues so that we can have appropriate expectations, communication, have predictable stops along the way with appropriate goals, not try to just treat the symptom or become mechanistic with our adjustments, with our maybe sometimes using our brain-based regulation tools or functional neuro tools like primitive reflexes, eye movements, cognitive games, nutrition, etc. And the thing is that the missing piece here that I'm going to say it, like all of these doctors that are in this scenario, the missing piece they've had is asking and answering the second question. And the second question is, what does it look like? Typical trajectory of development. And I'm not just talking about like milestones. I'm talking about beyond that. This is where we go, okay, we know what typical brain development looks like. We know how to look for clues that a child is either on a typical trajectory of development or they may be starting to have inefficiencies or gaps or alterations in the way they're moving through development. And the way we know that is we look at observable behaviors and tools and milestones and efficiencies and inefficiencies. We look at things like primitive reflexes. Are they integrating? How are they integrating? What's happening with tone and symmetry in a child when they're integrating? How about auditory, verbal, movement, touch tools, gross motor, fine motor? What about eye movements? How do I watch from newborn to 3 months to around kindergarten age to as we get into adolescence? What are the things I should be looking for in supporting typical development, but also when we have somebody that is not engaging in their world efficiently and it's showing up in behaviors, in reading challenges, in learning and processing differences, executive function challenges? What do we typically see on their what we call our functional brain-based exam, which is looking at that typical trajectory of development? What would be typical to see at what age? What is efficient? What is not? What could be the impact of altered or inefficient neurological function on the developing brain or stressors on the developing brain? That's the second question. And when we can ask and answer the two big questions, function of the nervous system, communication in the nervous system, input, processing, output, and what tools is a child using to process their world, and what does that tell us about their movement through the developmental trajectory or how they're moving through the developmental trajectory, how they did or how they are. And we can simply pick that up on our what we call watch and wonder, our observational skills of just observing a child and asking the right questions in a case history and maybe of their other providers. When we can do that on an exam, we can appropriately care plan based on what we found, and then we can do it on a re-exam to know how are we, if we're making impact in the nervous system, how is that actually impacting the developmental trajectory? This is what gives us the information to know how to then continue to care plan, how to know when do I need to co-care, co-manage with another provider? Do I need to work with an SLP? Would this be a great time to get an occupational therapist on board? What about oral motor function? Is this something that we need to keep working on the nervous system and watching the trajectory and just blindly waiting? Or are there indicators that tell us it's time to get someone else on board, or it's time to do neurocognitive exercises and games or neuro rehab? We don't want to guess, and we also don't want to treat it mechanistically like, hey, if they have subluxation, then that's going to be the cause of everything and they never need anything else. And we also don't want to just throw darts at a dartboard and guess. And we also don't want to lose the nervous system piece of it. We need to consolidate it, make it simple in systems, deep in understanding and knowledge, simple in systems, so that we have an anchor to knowing how to care plan, how to understand, how to communicate, and how to put this into our practice to have the absolute best outcomes, and or know when we need to add the next thing, remove something, co-care with someone else. This keeps us in our scope. This keeps us getting results. This keeps us understanding what's expected, what's not expected. It stops doctors from feeling like, oh my gosh, am I guessing? What do I say to the parent if one part of the exam looks worse and their symptoms are worse, or a new thing pops up? If you can have an understanding of the two big questions, altered nervous system and the developmental trajectory of the brain, beyond just the basic like reflexes and movement and cognition, like actually looking at the specifics and actually understanding what does that look like in behavior, beyond just emotional regulation and executive function, like what does this actually look like? This is the number one thing that I see doctors come to us with. Chiropractors come to us because they've been like, I know there's more than fight or flight. I know there's more to this story than just fight or flight is happening or vagal tone needs to be improved. And then what? And what is the impact on the developing brain? And what does that look like? And how do I understand that? And what are typical stops along the way? This is where we use our knowledge of the developmental hierarchies of the brain. We teach and use 8 of them to ground our understanding and to base our exams on. Can still be done very simply, very quickly actually. But we have to have the depth of knowledge to know what it is that we're seeing, what are we watching and wondering for, and how to partner with the parents and other providers to know what it is that we do so that we don't look so silly saying, well, we just fight or flight and we impact that and things will get better. One, it makes us pretty mechanistic. And two, it's not the whole story. And I think if you've made it this far, you know it's not the whole story and you're looking for more answers. And you're like most of the people that we work with.